everything about medical establishment. So before we start, request our chairman, Dr. Narayan Chandra Hepsur, to welcome the gathering.
Good evening, everyone, and the August gathering. It is really a pleasure to have Dr. Pawan Patil, who is very active in IMA in all the aspects of legal and hospital management board. Everything is such an active person. He knows in and out of things, and with him, we have a good panel of people who are going to talk to us. Dr. Suri Raju, Dr. Madhusudan Karignor, Dr. Naz Madam, Dr. Sanjeev Kulgod, Ravi Kumar Chaudhary, and Dr. Chandrasekhar. These are the panelists. I welcome you all. I welcome all the our past chairman, Dr. Shivram, incoming chairman, Dr. Shanai, and all the EC members, and our Dr. Sopimat, past chairman, and all the EC members, and all the members of ASI for such a nice session. I request all of you to please join and enjoy the session. Over to you, Chandru.
Yes, sir. So this session is moderated by Dr. Pawan Patil. He is a consultant surgical gastroenterologist in Gadag. Request Dr. Pawan Patil to start the program. Pawan?
Good evening, everybody. I hope my my screen is shared.
Yes.
No,
we can.
Yes, sir. Thank you, sir. It's a great opportunity to be part of all of you. At the outset, I would like to thank our dynamic president and secretary for taking up this issue on the request of all the members on how to establish a healthcare establishment and also run it successfully. So we thought of rather than lecture, we thought we should have opinions and their experience sharing amongst all the sector of healthcare establishments who have been successful so far. I know all of us as a surgeons are born leaders. The reasons behind we are a little bit on the other side of the medical fraternity because we stand alone on three different aspects. We are tuned to taking fast decisions. We are tuned to take risks, and we are tuned to manage the teamwork. So these three are the basic qualities to have as an entrepreneur. So that is what makes us a good entrepreneurs as well as to run a better healthcare establishment. So when this suggestion came from our president, we thought of a panel discussion rather than just a lecture. So I thought of including all the panelists from across different categories of establishments as well as from different types of establishments and those who are already well established and successfully running their establishments. So we have Dr. Madhusudan Karignur from Sirgupa. He has established his setup in a smaller place with limited resources. Probably when he started or even today, they are short of anesthetist or something like that. So, and he has been successful in establishing and running the institution. He was the past president of IMA also and past EC member of our KSCASI. Next was I selected one lady entrepreneur, Dr. Naz Madam, who has been very active. She hails from Hospet, running successfully along with Sir, their establishments. Next was we wanted somebody from Tier 2 cities like Bijapur, Dr. Ravi Chaudhary, sir. Probably I might say in this forum that I learned my first entrepreneurial skills from him. I was working with him during my internship. Amazing personality. One has to learn the patience and skill of running a beautiful establishment from a smaller setup to probably a 150-bedded hospital in Bijapur right now. Next, I wanted somebody who was part of a group practice. So Dr. Sanjeev Kulgod, who has been part of a group practice in Hubli, he's an oncosurgeon and also established a separate radon hospital exclusively for cancer care in Hubli. He is quite entrepreneur He knows the teamwork. He takes along the entire team very beautifully. Next was I was thinking of a bigger city where an individual can was established and run the establishment very successfully. Then came into my mind was Dr. Suri Raju from Regal Hospital in Bangalore. He runs a hospital in Bangalore. Very successful, very active person in FANA as well as in IMA and KSCASI. Then there is another group of establishments like people who are running chain of hospitals. So then came to my mind was Dr. Chandrasekhar, who runs a chain of hospitals called Kaveri Establishments. He was a Senate member at RGHS and also an active member of IMA as well as KCSI. So I welcome all the panelists for this panel discussion of everything about healthcare establishments. So we will go ahead with the various, I have divided this panel discussion into various headings, how to establish, what are the legal implications and how to run it successfully. Anybody in between the session, you have any questions, you can post it on chat box. We will take it up in the last. To start off, yeah. So the first topic I chose was how to plan your setup. So so what do you want? This is the first question anybody who is establishing a hospital. So I'd like to ask Chaudhary sir on what to be planned, how to answer this question.
So good evening, everybody. I'd like to be very short on this. Can you hear me, Pawan?
Yes, sir. Yes, sir. Yes, sir.
Yes. See, what you want means all the doctors, when they join the college, they will have their own ambition and their own ideas and their own, with their family members, their parents, everything. They should want to have their own one or the other way, whether they want to go at a corporate level and work, whether they want to just work in the government service, and whether want to have an own hospital and be entrepreneurs. So these are three ideas of their own, what they want to be after them when they join the medical profession. So it varies from person to person. This setup, in this discussion only, we want to focus on entrepreneurs who wants to establish their own independent hospitals. What I want to tell you is, what do you want? As a health professionals with my 30 years of experience, the health profession is changing a lot. When we joined the college, it was more of a service. When we went into the practice also, we joined it as a service to the public and the society. And the society also encouraged us a lot to establish our own entrepreneur, own hospitals, own setup everywhere. Even the KPMA Act was also not there. So whole the society, the law, and everyone were behind us to establish an hospital and run the show to the society. But the present scenario is totally changed. The government is putting into the, as an act in the KPM Act, they want to hold our neck. The public look at the suspicious, and public look as a consumer. Even the court has told that they are consumers and they are liable to sue us in the court of the law. So the whole scenario has changed in the last 30 years. So with this new act and new concept and new ideas with the society, public, and the doctors, we have to change our own all the views to set up an independent hospital. So what I feel is, to running an independent individually with all this society's suspicious view against the doctors, towards all the doctors, and the government is trying to hold the neck, wants to extract a lot of money as a fees, and even the government officers, they want to hold our neck and see that our setup should be under their hands. We cannot work independently on their own. That is the view of the society. So what I feel is, individually it will be more riskier. It depends depends on where we practice. If you want to practice in Tier 1 like Bangalore, if you want to Tier 2 in the Mangu, Supli, Belgaum, Davangere like that, Tier 3 in the district places, Tier 4 is the Taluka places. Still the Taluka place is very open for everybody. Like what I mean, even the MBBS doctors, consultant, even the super specialist, basic super specialty like urology, and still there the scope, the society encourages, it is easier to set up a hospital at the Tier 4, Tier 4, what I mean is taluka places. And in some district places, still the scope is there, they encourage us, and it is still, we can independently start our own entrepreneurs. But in Tier 1 and Tier 2 cities, it is very difficult to run, what I feel like, and we should come in the group. We should come in the group and establish a hospital instead of handing our own into some of the corporate and some of the other than the medical profession who wants to get into the hospital and run the show. Instead of that, we should come down with our egos. We should come down and start hands with our own colleagues. And in the long term, what I mean is it long term. It should whatever loss profit, up, down, for good profit, loss profit, we should make at least 5 to 10, minimum 10 years. We should be together. We should not fight. We should come down with all the egos and start our own setup with all the specialties with the like-minded. That is what I feel like in the Tier 1 and Tier 2 and even the Tier 3 cities. Tier 4 is independently, we can still start.
Sanjeev sir, can you add how to plan? What exactly you want when you are planning? How should be your...
Yeah, at the end of the what I feel is at the end of our profession learning, either a MS or a super specialty. First is we need to choose where we'd like to start our practice. That's the first and the foremost important, as the Chaudhary sir mentioned. Whether one wants to settle down in a Tier 1 or a Tier 2 or a Tier 3 city or a Tier 4 city. That's one thing one need to make a very, very clear plan for themselves. Then take a call on what is available in that particular city. At a given point of time, if that city has a pretty good hospitals available already existing, like a corporate hospital, somebody wants to settle down in a Bangalore-like place, already corporate hospitals are available, where one can look to join them and probably excel in a clinical services. But as you put it, we surgeon are a different breed altogether. We have lots of our own, want to establish our own stuff wherever we move. Lots of risk-taking aptitude is there with us. So that is also pretty good. It does not mean that a Tier 1 city is not, or Tier 2 cities are not for the entrepreneurship. They are there. There are opportunities. But only one need to see that, as Dr. Chaudhary sir has put it, what I want in a 5 year down the line, 10 year down the line, 20 year down the line, we need to establish, plan ourselves what I want to become 10 year down the line, 20 year down the line.
Very
would
true.
like just do my practice, or would like to take responsibilities of establishing a hospital. Because just doing a clinical work, probably every surgeon or everybody wants to do that. But somebody with the zeal to do our own hospital will have an additional responsibility. One need to understand there is an added responsibility, which is much more than what a clinical work is.
Yeah. Thank you, sir. To summarize, what exactly sir told was, when we finish our masters or super specialty, we need to have what exactly we want. That is, we should have a short-term goal. Then 5 year down the lane, what I want to be or what I want to establish, and 10 year, at least 10-year plan you should have, so that you will have clear picture where you want to be after 10 years, whether it is in a medical college or whether you want to establish a single specialty hospital or a multi-specialty hospital. Then also, how you want it. Can I ask Dr. Naz Madam to say on this, whether it should be a single individual setup, family, or a group?
Yeah. Good evening, everyone. Thank you, Dr. Pawan, for including me in this panel. And thank you, KSCASI, for selecting this topic, which probably nobody would have touched. Now, if we want to think of how to start a practice, first, why do we start a practice? We start a practice because it gives us independence. We do not depend on somebody to give us employment. But then this comes with a lot of responsibility. And then we have to think whether I would want it as an individual, as a family, or a group. When there is an individual, maybe a couple who is doing it, it may become easy because both of them would be like-minded quite often. And at the same time, the investments would go into the construction of the hospital and into the maintenance of the hospital. And if there is a family who wants to set up a hospital, especially if there are more than one generation of doctors, then it would be a very good idea for that particular family. And the family, if not as a doctors, they can join in as people to manage the hospital, and they can also be of a great help. And then for those people, especially with multi-speciality hospitals who have planned a multi-speciality hospital, it would be it would be better to go in for a group practice, and the people with like mind should discuss together. And it is not only the losses, the profits, they have to plan for the losses as well, and those people should be ready to share the losses as well. Only because in the first 2 years, I feel most of the hospitals will not have any profits. It will be mainly expenses which they have to spend on the salaries of the people and the maintenance of the hospital. And all these things put together, they have to run the show for the first 2 years. Only after those two years, or maybe sometimes even longer, the profits will be counted. So that is how we should plan our practice. And in smaller cities, it is better to have this we have this individual people usually have a couple who have their own hospital. But that doesn't mean that in bigger cities, in tier 1 or 2 cities, there is no opportunity. You can move to a little peripheral part of the place, and as you can provide more service and are more friendly, the people definitely want somebody who give them service at that particular time and the service they require. So to set up a practice, it is just not your building or whatever. It is your body language and the way you talk to the patients and the way you convince the patients for the treatment. And it is over time, that after so many years, that you build up your practice, and through the word of mouth, it spreads, and then you start increasing your practice.
Yeah. Thank you, madam.
Yes.
One point of caution here is individual and family. We see very less of litigations after 2 years, 3 years, something like that. But when you're doing, if you are planning for a group practice, my piece of advice would be make the policies on very clear. You have multiple discussions before you establish any setup, because we are not trained into entrepreneurship during our college days. What naturally happens is we have surplus amount. When we do it at a group practice, we are ready to fund a partial share of it, and rest is taken care at a later date. This is what is the simple thinking of many of us. But what advice from my side would be, because I have seen groups ending up and doing really well. So let us take good examples and take it forward. So writing up of policies at the beginning of establishment is very essential for any establishment to run successfully. Then next is what is the target population? How to decide what is the target population? Can I ask Dr. Surya Raju sir to address this? Because he is from a bigger city, and how he planned himself on establishing at his place.
Good evening, friends. First of all, I want to thank Karnataka Surgical Association for providing this opportunity and starting such a wonderful program. Thank you, Dr. Pawan. It is as Dr. Sanjeev, Dr. Ravi Kumar, and Dr. Naz Madam has already mentioned, everyone's dream is to start an hospital, especially surgeons feel that we should have our own because we feel enthusiastic and energetic. And it is the desire will be there, but starting a hospital at the right place at right location with right planning is very important, as it is very, very important to do proper analysis where to start an hospital. Now, there is a recommendation that there should be 2 beds per 1,000 population. When you start an hospital, what is the target area? What is the kind of population that area is having? Whether real requirement and demand is there or not? And what kind of population and surrounding area it is? It is very, very important. Suppose nowadays there are so many groups are there, research groups are there. If you spend some money, they will do thorough research and give you the report whether that hospital is sustainable or not. Because I have seen many people starting a hospital and struggling a lot and waiting for the right time. See what happens over a period of time, we lose patience. Initially, they say we should wait for 1000 days to break even. But how many people have that capacity to sustain for 1000 days is the question mark. That real demand should be there. So thorough research is important, and the kind of population is important. When you start an hospital, whether you are having insurance schemes and proper marketing and branding, all those things are important. So my advice is please conduct thorough research. When I started Regal Hospital, that was periphery. It was in the outskirts of Bangalore. Initially, it was surrounded by empty area. So initially, 1000 days, as I told you, 2 to 3 years, I did not make any money. I was running at a loss, and I had some 6 to 8 months money in my bank account. I invested, kept on investing money, and very patiently waited. Then I started getting the results. So it is awareness about the healthcare. Initially, what happens? People tell you start a hospital in this area, sir. There is no hospital. There is no competition. A lot of apartments are there. A lot of buildings are there. If you start, you will do very well. Please don't listen to those words. Please do thorough research, because starting a hospital. Hello.
Yes, sir. Continue, sir.
Starting a hospital at a wrong location and constructing a big corporate hospital at when there is no demand. These things we should look into factor, and we can't blame that people are not coming, patients are not coming. I started a hospital with lot of hopes. No, please do thorough research. This is my advice.
Yeah. Regarding the marketing and branding strategies, I would like to add here. When I expanded my father's establishment, I didn't do any marketing or branding because my father's name was already there. But when we recently, 2 years back, we started an IVF center, I felt marketing and branding strategies are also helpful when you start a new establishment, a new specialty in that area. So that is also equally important. Depending upon the need and the catering population, you will have to plan yourself regarding various things of target population. Then can I ask, sorry, one second. Building planning, how best we can plan when we establish. Can Chaudhary sir add on these points?
Building planning.
I have seen Chaudhary sir starting from a rented premises to having a very huge establishment right now. So I thought he is the best person to answer this.
No, earlier, the establishment used to start with a small clinic. Then once we have a good market, a good number of patients, then we used to have 8 to 10 beds. Then after that, we expanded to, if we have got more number of patients and the requirement is more, then we used to establish again with the 20 beds, 25 beds like that. So initially, I started in a rented house because investment in the land, investment in the construction, it will be very huge in the present scenario. When you select a place, especially in the tier 1 is almost corporate, tier 2, tier 3 cities, the land cost and where we want to start the place and the building construction will be taking a very huge time, huge money and huge risk in the hospital. So what I advise in the new setup, when you want to start a new setup, better to have a rented building which is easily accessible by road. By like you have to establish in a means accessible road means your ambulance should come, the patient should easily reach, it should be nearer to the either the bus stand, railway station, or any good good marking to establish. Means you can say my hospital is there, you can come and easily access to my hospital like that. So I feel it's better to go with a rented building, and then other things like you have to invest in other furniture, your beds, you have to invest in the human resource. So there are so many investments still. But in the furniture and other equipments, you can have a EMI from the vendors. But human resource we have to maintain. What I feel is before we start, even in the rented building, we should assess what is the minimum expenditure per month. How much money is without a patient, without a single patient, what is my expenditure? Finance. Okay.
Yes,
We'll
sir.
go with the
Finances will
finance.
come later, sir.
Right.
What sir wants
I
to
feel
tell is
that-
you should have a short-term and long-term planning. Short-term,
Yes,
what sir told is if you are not financially initially at a good stage, so you can start off with rented and have a long-term planning of having your own setup. That is what sir meant.
Yeah, that is what I think. Yes.
Yeah. Can I ask Sanju sir to add on how to plan when you are having your own establishment? What is the role of our architect? How freehand you have to give him, and how the planning has to be there?
Pavan, actually, like when you plan any, whether it's a single specialty or a multi-specialty hospital, you need to really incorporate one is an architect. I can say that architect not alone. You need to have the builders. You need to be taking there also one of the very important partners for building your establishment. Third one is yourself as a promoter. You may be single or you may be a co-owners, the promoters. And the fourth important aspect, if you are planning for a bigger establishment, then you need to look for the project management consultancy. Because lots of we have also ourselves looked into when we went through our first project, the Tudarsha. The initial plan was we involved the architect, we involved the contractor, we did a proper what we call that tendering processes for various this one for a civil, electrical, and this one because it was a bigger establishment. So almost around 7 or 8 subspecialties, we floated the tenders and called, negotiated. These are all the things we did.
Yeah.
But apart from that, why I said a project management consultancy, if you have a bigger project, then better to have a project management consultancy because the timeline will be not maintained by us as a promoter, sometimes the architect, sometimes the vendor, or builders. There is a coordination required between all the three.
Yeah.
What happens here, if a fund doesn't flow, the builder will delay the process, and architect doesn't give the timely plans, then again the project will halt. If you have a project management consultancy who will coordinate with all these three and see that it is done in a specific time what you have planned, because the timing is very, very essence of any project. If we delay in any project, suppose if you are taken a huge debt, it is going to impact us badly.
Yeah, very true, sir. Sir, what I would like to add here is what sir told is very true. Architect is very important, and the involvement of the consultants, whoever are in this establishment, even if it is an individual or a family or a group, every individual doctor has to get involved in this because day in, day out, you are the person who is going to run around this hospital. So you should know the working plan, and so that you can keep the movement very minimal. That is one thing. Second, as sir said, timing of completion of the project is very essential because see, whatever said and done, business, not business, this confusion is always there in medical fraternity. Considering it as a business, so any commercial building, the sooner it gets completed and starts functioning, the sooner is the returns coming back. So that is very essential. The end point or the time frame has to be planned very well. So it should also involve various long-term planning like STP. Even if it is a smaller setup, tomorrow you want to increase the number of beds by increasing the floor, you should plan for STP, ETP or fire planning. Everything has to be done before in hand in consultation with your architect. So thank you, sir. Next, coming to manpower. This is a major...
Pavan.
Sir.
Can you hear me?
Yes, sir.
Can I add one point over all this?
Sure, sir.
Yeah, you have asked what do you want. Definitely a long-term plan is ideal. And you've asked how you want. The scenario is getting changed now. When we started our rural practice 30 years back, the things have not changed. I'm working in a Taluka place where one anesthetist have come just now. No physician, no radiologist. 7 gynecologists are there, no anesthetist. So things have not changed, but still over the period of time, individual and family practice was ideal earlier. Now, group practices is very ideal because it changes your responsibilities. Expectations from patients is definitely increasing, and legal sharing, legal responsibilities, and expectations from different specialties by the patients is increasing. So we need to have a better is group practice. And as far as the building planning is concerned, always have 20 to 30% extra space while you are building your hospital, because coming days, the changes in legal perspective, the expectations from government and scenarios like COVID, we had this oxygen plant. Always have 30 to 40% of your hospital planning should be for the future planning. And the one very forgotten point is always build your hospital in a commercial sites, not in a residential sites. Am I right, Pawan?
Yes, sir. Or else,
Yeah,
even if you are building in a residential site, you need to take an NOC from the surrounding tenants. Otherwise,
No,
later on,
that is-
somebody can file a case against you that you have not taken an NOC.
No. Pawan, there is a misconception in this. The law of the land doesn't permit, even
Yes.
if the NOC is given by the surrounding people,
Yes.
your hospital cannot be run in a residential sites, not the area. There is no confusion. It is not on the residential sites. Always plan your hospital, build your hospital in a commercial sites that is catered in a area.
Yes.
Sir,
Definitely
if
some
I,
commercial
sir,
sites will be
sir,
there.
if I add one point, it is allowed under Zonal Regulation Act. It is allowed in residential areas, schools and hospitals. It is allowed. Only criteria is there should be 40 feet road in front of it. Second thing is the site should have 9,600 square foot. You can amalgamate the sites also. This is what is there in the Zonal Regulation Act.
Yes, sir. Yes, sir.
One,
That is true. But one main important, even if it is as per what Harsha sir said, the NOC part is very mandatory that surrounding people has to give an NOC before taking any permission.
no, that is there for commercial and residential
You need to
sites
convert
also.
it into commercial. Even if it is a residential, we can convert it into commercial land.
Sir, we can't convert it into commercial land, sir.
No,
We
no.
can pay commercial tax, that's all.
Yeah.
See, once the conversion of land has happened through deputy commissioner, there is a fixed rule which cannot be, again, no one has the power to make non-commercial into commercial. It only government of Karnataka will have the power. That is why there is a provision in zonal regulation. Zonal regulation is why it has come, because zonal regulation, to overcome all these problems, zonal regulation has come. In Zonal Regulation Act, a residential plot which is more than 9,600 square foot with a road of 40 feet in front of it can be license can be granted, but license should be taken as hospital construction only. And all the municipalities and Mahanagara and also the BBMP, they are giving the license with the mentioning of Zonal Regulation Act. Zonal Regulation Act, anybody can type it, sir. It is available online.
Okay, sir.
Yeah.
Thank you.
If you want to have clinical practice, that is only consultation practice, that is allowed according to the law of the land. But there is a rider here. Only you can use 30% of your residential site for only for outpatient clinics, not for inpatient purpose.
Okay,
Sir,
sir.
for construction of hospital only it is given, sir.
Okay, okay.
Sir, even I too, sir, I have taken non-agriculture land, converted into residential, and a bigger part of it, I took the permission as a hospital. So the BDA authority has got a permission. If they give permission as a hospital, you need not have to go for a totally commercial conversion. My land I first converted into non-agriculture, then I made into residential. From the residential, a major area, what sir told, I took a permission as a hospital, a 40,000 square feet area. I took as a hospital only.
So ZRA is a clear definition. What can be constructed in residential areas, sir? ZRA.
That is what even the municipal commissioner and the BDA commissioner convinced me when I went for planning of my hospital.
Yes, sir.
Sir,
Can you
as of
the
today,
next
things are
point?
moving on. Sir, Pawan,
Yes, sir. Can we
as of
start with the
now,
next
things are
point?
moving on.
Yeah.
Yeah.
Regarding manpower, can you add, sir? Madhusudan, sir? Because
Yeah.
getting trained and qualified nurses in periphery is very difficult. So that has to be planned well in advance. And in coming days, it is going to become very strict as well now.
Yeah.
Because recently,
So,
KPMA, there was a discussion that they are going to fix so many number of qualified nurses for per bed, per 4 beds or 5 beds, like that.
that
So,
norm is there already.
yeah.
For every 10 beds, one nurse has to work. It is fixed. There is a ratio. For
Yeah.
every 10 beds, one nurse, and with 8 hours working hour. That means you need to hire 3 nurses for 10 beds hospital.
Okay.
That is there. But as far as the manpower is concerned, are we? This is the thing that I have asked the policymakers, even health commissioner and the KPME director. Are we able to produce so many nurses, nursing staff for the 35,000 KPME hospitals which are there? As
Yeah.
far as the bed strength is concerned, it is more than 1 lakh beds that is existing in Karnataka.
Correct.
Are we able to, these nursing colleges, are they, I mean, so many nurses are coming out? So that is a question, but it is a double-edged question wherein we are fighting against unqualified doctors as duty doctors in our hospitals, like Ayurveda, homeopathy. Those doctors, we are fighting against them. But at one end, we are asking the qualified doctors to work. And the other end, we cannot go for unqualified staff to be recruited in a hospital. Definitely trained staff is mandatory, and we need to go in that direction.
Okay. So, Naz madam, can you add how much is minimal, sufficient, or excess? So that how we have to plan it?
So when we plan for the staff, we need staff round the clock, starting from security guards, nursing staff, duty doctors, group D, and a manager. And most of the times we do not have MBBS doctors as duty doctors. We may have to manage as ourselves. We have to be duty doctors at most of the times. And for the staff nurses, as Dr. Madhusudan said, it is very difficult to get trained nursing staff. And even if they have a certificate, most of them do not have adequate training. It is only on paper that they have a training. So it is important that we give them training and regularly update them whenever we have some new establishment in the hospitals. And regarding minimal, sufficient, or excess, working with a minimal staff, I think initially you would start it, but then you should have an adequate staff. You should have for each ward at least you should have 2 staff nurses and night duty staff, and those people who are for even the security guards should be there round the clock. And then you should have a little excess of them, so that whenever somebody goes on leave, it is better to have a little excess, so that especially when there's a crisis, they will be there handy for you to take them. So investing in staff is the biggest thing, and we should do. And this is the backbone of the hospital. So you should do adequate investment on your staff and pay them adequately, so that they will be with you for a longer time. And a good staff is your asset. So
Yeah.
maintain 1 or 2 good staff at least, so that they are there behind you to take care of the hospital.
Yeah. I would like to add here, once I was discussing this same issue of staff leaving our hospitals and going, we having shortages and all. I was discussing with one of the industrialists here in Gadag. How do you manage when your staff quits the job, or you have shortage or something like that? He told me one beautiful thing which I would like to share with you. He said, never consider your staff as an expense into expenses. Consider them as an investment. So having sufficient staff, I have evolved in this. Initially, I was having minimal staff, then made it over 3 years or 4 years. I made it sufficient. Now I have excess staff, but I am secure. Like even if suddenly one or two people quits the job or they leave absent, I can manage the staff issues very well. That is how the manpower has to be managed. So as per your workload, you'll have to go on increasing your staff, and a bit of excess is always okay rather than having a minimal staff with a bigger establishment. Sanjeev sir, can you add how essential is staff training?
Luckily, we have getting a trained staff and a qualified staff.
Yeah.
In fact, since if you are planning to go for a NABH, either NABH entry level, or if you are planning to go for the NABH full, you need to have a trained staff and a qualified staff, and with the proper degrees and everything.
Yeah.
Apart from that, we need to have a continuous training. We have actually created our own 40 module training system. 1 year we have a 40 modules. Every week, 1 or 2 modules are taken by our nursing superintendent, and he trains them on a regular basis. And nurse to bed to nurse ratio, again, it varies whether it is a ward, whether it is a HDU, or it is a ICU. Yeah. Based on that, nurse to bed ratio varies, or nurse to patient ratio varies. And as per this one, ideally in ICU, 1:1 is recommended, but 1:2 or 1:3 is acceptable in a setup like a Hubli. And that is one part. Second thing, as all of you put it very nicely, that at least 10 to 20% of excess staff keeping is always a better. And as entrepreneurs, we know that they are the asset to us, as Naz Madam has told. And in fact, we pay them pretty less. In fact, we need to improve paying to them. Probably lots of trained staff stays with us. They'll stick to us, and they remain as an asset to us.
Yeah.
So investing on them, as you put it rightly, it is a right way. We should invest on our manpower.
Yeah. Regarding
Sir,
the training, I would like to add here. One of the major differences, what I see between tier 2, tier 3 cities, individual setups or multi-speciality setups, as compared to corporate setups. Corporates, when they employ these staff, they don't directly put them onto duties. They take rigorous training on their establishment, how it is functioning, what are the forms, what are things. For first 10 to 15 days, they are rigorously trained on that. And on a regular basis, they have a training modules, as Sanjeev sir said. This is what we fail in tier 2, tier 3 cities in a smaller or medium-sized hospitals. So I request everybody that you have a certain set, even if you are not having a good trained staff with you who can train the other staffs, you can hire on a part-time basis from other establishments. You can call them, like I am doing it now. There is a staff nurse who is trained very well. She takes classes. I call her on a part-time basis and ask her to take classes on various aspects, be it cannulation, be it bed making or anything of that sort. So staff training on a regular basis is very essential in running a very good hospital. Next, let us move to equipment planning.
Sir, if I add one
yes.
point regarding staff, sir,
Yeah,
like we can have an agreement with them, first thing. Second thing is, along with that, we can have in our association, we can have a rigid rule. Once the staff changes the hospital, you should always bring NOC from the previously worked hospital. These two things will prevent that unnecessary competition.
Very true, sir. Very true. But practically, it is not possible because you need to have
That's been done. That's been done in our taluka, sir. We are doing
smaller places, it is very essential. You know, even in tier 2, tier 3, it is very easy because if not NOC, I'll at least call the other person and ask, how is this staff? Why is she leaving? All that thing is asked. It all depends on the individual's moral and the compatibility with the other hospital which she has left. So in smaller places, what you said, Harish sir, is very true. But as we go on bigger places, it is very difficult and getting NOC or training certificate is also very difficult for them, certain people.
Pawan,
Yes, sir.
I'll add something. See, let us not be so much legal in these aspects.
Yeah.
Because we need to keep some trust. And definitely in a smaller places, we have to trust. Just a call the previous owner, take the feedback, then hire them.
Yes, yes. That is what is being done in smaller places, sir.
Yeah,
As
yeah,
we
yeah.
go on bigger places, the communication between our own people is less. So it has become a little bit difficult. Let us go on to next point, equipment planning. Uh, uh, Dr. Chaudhary, sir, can you add on this? How we have to plan our equipments, how it has to be maintained and the other things?
Equipment, again, it depends on the which branch you are practicing. As physicians may be having a minimum investment in the equipment. Surgical branch is we need more of OT setup, ICU setup, and investments are more for a surgical setup.
Yeah.
And what I feel is there are so many vendors, even in tier 3 cities, who definitely help us in giving all the equipments. And if they will give their own EMIs. We don't have to go every time to the bankers and get a loan for it, because bankers initially they won't give such a huge loan for the establishments, because we will be not having a good return. We don't having a income tax, sound income tax return. So we can negotiate with the vendors and have their own EMIs and start the equipment. That is what I feel like, with
Yeah.
minimum investments.
Dr. Suriraju, sir, can you add on this?
Yes, sir. Regarding the equipment, it is very essential to plan in such a way. We need to increase the equipment according to the requirements, sir. In the beginning itself, if you invest in high-end investigation tools, then you are losing a lot of money. As you start running the hospital according to the requirement, according to the time, we need to increase. Suppose today CT scan, MRI, and ventilators, these are the high investigation which cost a lot. So keeping them, even though it is not required in the beginning, it is a waste of money. We need to increase the overall equipment according to the needs, sir, over a period of time, slowly and steadily. This is what I feel.
Very true, sir. So planning of buying the equipment is also very essential. It is not that we have money now and we invest on the equipment and end up not using them for years together, is not done. So when you are planning for an equipment, we also need to know the essential requirements, the quality of the equipments, and also negotiate with these companies regarding the warranty as well as AMC and CMC before in hand. So next, coming to finances, a very important topic. How to plan your finances. Again, Dr. Naz, madam, can you add on this? Most of it has already been discussed.
Yeah. So regarding the finances, say if you're starting an individual practice, it depends on how much money you can invest into the practice. And as it is already mentioned that you start in a rented building, and whether you're starting a group practice or depending on that you pay or according to your daily income you pay. But whatever said and done after certain time, you have to know that it is. In the first 2 years, you will not have the same patient. Even if you're practicing in the same place, the patients will not just shift to a new hospital. So you have that waiting period and you should sustain that waiting period. And if a family is there to support you, that is well and good. And then you can go through investors, but it is always better to go through banking. And when you go through the banking, you try to take the term loans, and you see if you can give a pre-term closure of the loans as well. And some people might offer you less interest, but at the same time the processing fees will be high. So read the small the lines written in the small letters and go through it carefully before applying for any loan. And during repaying you should be very prompt, and then that first 2 years usually are given as a holiday period, and after that you have to repay your loans, and that you should be able to sustain.
I'd like to add here, many might have already been receiving phone calls. Based on your degree, we'll give you unsecured loans, and without any collateral securities, we'll give you up to 1 crore, 2 crore. There are a lot of policies made by central government that up to 1 to 2 crores is being funded just on CGTS schemes, that is on your degrees. So just don't blindly go on these issues, because you need to plan yourself. what establishment you are having, what is the returns you are getting. Unless you have a proper policy, pricing policy, for that you require to discuss with your chartered accountant whenever a banking a person gives you a loan, he asks for certain set of documents. Out of that, there is one document called as projected balance sheet. So that is very essential that you go through that projected balance sheet. If chartered accountant he prepares it on his own without your consultation, then you are going to end up in problems. Sit with the chartered accountant, discuss with him what is your present number of OPDs, what is the present number of surgeries you are doing in a month, and how it is going to increase after 6 months or 1 year or 2 years. Based upon that, he will have a projected balance sheet prepared for you. Based upon that, you think and take the loans. Don't just blindly take loans and end up in problems and have stress to your life. So another thing is I wanted to put on here is working capital. Many of us don't think of this. We say my hospital establishment is costing me 2 crores. I'll take only 2 crores. We never think of working capital. What is working capital is you should have sufficient balance in your account, either in a OD facility or a loan which is remaining. That is, say, your project is of 2 crores. You should have a balance of around 50 lakhs to run your show without any much hassles for next 6 months. You never know that how it is going to improve. Your practice is going to improve or your surgeries, number of surgeries is going to improve. So this working capital is very essential, which many of us fail to plan ourselves. Next, as
Dr.
already...
Pawan, one point I would like to add here.
Yes, sir. Yes, sir. Yes, sir. Please.
I believe in 50-50 formula. Means 50% you take the loan, 50% you invest from your, assets or your money. Because totally depending upon the loan is dangerous. Because you will have a lot of stress. So the loan we should take in such a way, it should not cause more stress, and we should able to pay the repayment of the loan should be easy. So 50-50% formula, I think it is ideal when you start a hospital.
So regarding the deadline to start, already Sanjeev sir has told it when we are planning for building that you should have a deadline when to start your establishment. That is when you are constructing a building or establishment, you should have a deadline when to start. Regarding software, can I ask Madhusudan sir, because we are proud to say that IMA has launched its own in collaboration with another company at a very meager price. IMA has launched an hospital software. So can I add Dr. Madhusudan sir to add a few words on that?
Yeah, thank you, Pawan. And you're also part of it.
Hello.
You're knowing much about that.
Sir, your voice is breaking. Hello.
Yeah, heavy rains is a network problem.
Okay. Yes, sir. Hospital software is is quite essential. I'd like to add few points. IMA has launched a software along with a multinational company at a very good price. Dr. Naz Madam is already using it. She can throw a few words on that. Dr. Naz Madam?
See, using a software is very important for the hospital, both for outpatient as well as inpatient, and that will give you the doc choice what we have for the IMA what we have chosen. It gives you a cloud facility as well, and that is a very good backup whenever there is a problem. They solve it very fast, and the purpose of choosing a software through the IMA was to reduce the cost, and then you know that when a good company is giving you a software, after certain number of years they'll not back out and your data is secure. So that was one reason why we chose this doc choice, and it is you have it at a very reasonable price with a good backup. So having a software for the hospital will help you to retrieve all your data whenever you want it, and you can save your data or on time, and you can train your staff to do this to upload these, and then you can get access to it at any time you want. So having a software to all the hospitals, I would say even smaller hospitals, because whenever they take a bill from you, they can use it as a document, valid document in the court. You cannot say that this patient has not come to you. So it is better to have a document, and having a software is very important.
Yeah. Coming next to licensing of hospitals. Recently, I gave a talk in Mumbai on what are all the licenses involved in healthcare establishment. So I had to study it a lot. So to my shock, there are almost 110 laws which are governing our healthcare establishment, which many of us are unaware of. So, but at least few of them which are very important, let us take into consideration. First and foremost, I would like everybody to register for MSME. There are few of the benefits right now, and some are coming in on the way. Like MSME, if you, it's very easy to register. If you can create a Udyog Aadhar, which any of your CA or CA persons can get your registration Udyog Aadhar done and MSME registration done. If you get that, you have some amount of subsidies in electricity bills, as well as the trade license is exempted for MSME registered establishments. So that is very essential. And you get a waiver of interest from banking loans if you're MSME registered. That is almost 0.5% reduction will be there if you are MSME registered. So next is KPMA. Madhusudan sir, is your line clear? Madhu sir?
Yeah, Pawan.
Yes, sir. Can you add a few points for KPMA and other licensing?
Hello.
How early you will have to apply for KPMA? Hello.
Pawan, lot of distance.
Okay.
Lot
Can
of
I-
thunder.
Yes, sir. Yes, sir. Surya Raju, sir, can you add? Hello.
Yes, sir.
Yes, sir.
As you are aware, like now, in order to start an hospital and running a hospital, we need to take a lot of permission. And KPMA, Pollution Control Board, and trade license. Like KPMA, again, we need to renewal to be done every 5 years, and a lot of finances are involved to get the permissions. Again, to get the Pollution Control Board, they are asking for, STP and ETP plants, everything should be ready. At the same time, generator license, etc. And trade license, again in Bangalore, the cost is going up. We are paying almost 75,000 per year in order to renewal. Every year we need to renewal. Again, the fire safety wise, we are, there is building height is there. We are not fitting into that one. That's why we are we need not worry about the fire safety.
Present law for fire safety, I would like to add here is 21 meters. But
21 meters.
all the hospitals should have fire compliance done. Whether you
Yes.
take NOC or no NOC, fire compliance is a must, even for a single clinic also. NOC, there's still ambiguity who has to take it related to hospitals. There is lot of work being done to get this NOC out of KPMA ambit, but it's still on work. So I feel fire compliance is a must for all the hospitals. So take care, especially a piece of advice for the new establishments who are planning. See to it that you are fully fire safety compliant as per the norms. Don't take chances regarding that, because we never know what laws are coming in next few years.
Sir, can you elaborate what are the norms which we should take below 21 meters and above 21 meters?
Sir, it is as per the fire department is using National Building Code as the reference. It is just a guidelines. It is not the authoritative document that you have to follow everything. But fire safety people or fire department people are using it as a guidelines. So if you go as per that, we come into C1 category, and it is a complex issue. It's a separate topic as altogether. So what we have tried to do is we have requested the Home Ministry to amend the Fire Act of our state, mentioning hospitals separately and based on level of hospital. Level 1 hospital should have this. Level 2 hospital should have this. Like this, if they can modulate things and give us, then it will be easier to follow. Otherwise, every district fire department is using different norms and exploiting the people. That is what is presently happening. There is no clear-cut guidelines on hospitals. If you go through NBC, there is a lot of ambiguity. It says that if it is more than 1,000 square feet and having a basement, you should have something else. If you don't have a basement and you are 1,000 square feet and only 1+1 floor, there is a different guidelines. So it is quite varied type of guidelines which is there in NBC. And applying it in our establishments, it is becoming more complex altogether. So basic thing what I would like to suggest is any hospital of any size more than 2 floors, better to have a down hydrant system, centralized smoke detector system and an announcing system, and on a regular basis, mock drills of fire mock drills should happen. What they want to see is whether you are able to evacuate in fire, and fire department will happily come and do the fire mock drills. In my hospital, though it is not fully as per NBC code, they were happy to come and do the mock drill with the help of our own staff. They trained the staff for 10 days. They made the teams. They did the mock drill. We video recorded it and it is saved, that video recording. So have at least basic things. If you call any fire vendor, he will say what is the basic things which can be done, and they themselves will get you a NOC also or the compliance certificate.
Yeah, Pawan.
Yes, sir.
Can you hear me?
Yeah, now I can hear, sir.
Yeah. One important point from the Indian Medical Association Karnataka State Branch is concerned. We are seriously involved in policy making for the KPME and fire safety norms. As you said, NBC guidelines are applicable to as generally as buildings. Hospital is considered as a building. We have requested and we have planned through the legal commission, home department, seriously involved with think tank of IMA. Even Pawan is also there, where we wanted to have Fire Safety Act of Karnataka for hospitals, a separate act, which was introduced, which is already existing in Maharashtra and also in Telangana. There is a 19-page act which is user friendly for the hospitals, where they have very well simplified the guidelines, which are really practically applicable to hospitals. So that we are trying it now. Probably in the coming 1 or 2 years, that will come through the what do you call that? Legislative. It will take a legislative shape. The one thing. Second thing, the KPME, we have simplified and easified the licensing part also. Hello.
Yeah, renewal part of KPM.
Yeah, renewal part also. So even online, what do you call that? A downloading of the certificate also. So many things. Even trade license part is also. There is a lot of confusion regarding trade license. What we have done, we have easified. Like there is an order in 2021. Am I right, Pawan?
Yes, sir.
20 and 19. Like a trade license is not a required document for they're taking a KPME, and also occupancy certificate, which is very difficult to acquire in Bangalore metros. That also we have taken it out. We have requested them to take it out, and only rent agreement is accepted now. Those are the changes that have happened in KPME, and in the coming days. Definitely, we will simplify. Probably, there are 3 committees in the KPME. One of that is infrastructure committee. Probably in the coming days, it will make a tailor-made levels of hospitals, which will be user-friendly.
Okay, sir. Regarding PCPNDT, there is a lot of news presently in Karnataka over PCPNDT. So a lot of raids happening to hospitals. So I request everybody, please see to it that the documentation of PCPNDT is kept properly. even when you are planning establishment, these laws are very essential and has to be followed. Especially PCPNDT, MTP also is being taken care now in a very strict manner. So the registers which has to be maintained for these two are very essential and as per the norms. Regarding drug license, if you are running your own pharmacy, then you need to have a drug license as per the drug licensing norms. And if you want to keep any narcotics like morphine, fentanyl, you need to take narcotic license also. There are again separate guidelines for that. You need to have that. Regarding AERB, can I ask Dr. Sanjeev sir to add here? Because he has a radiation unit.
Yeah, AERB is for not only for a radiation unit, ideally like
Hello.
hello.
Yes, sir.
Hello, am I audible?
Yes, sir. Yes, sir. Yes, sir.
Yeah. So AERB, apart from even for X-ray, even for the C-arm, even for any mobile X-ray, we need to have a AERB permission. Even for a mammography, we need to have a AERB permissions. And the calibration need to be done on a yearly basis by the authorized agency of the AERB. Either the company can do the calibration or authorized agency can do the calibration. We need to be complying as per the AERB through the ELORA. ELORA is a portal. Through ELORA portal, one need to comply with. And usually what we have done is we have a biomedical engineer who are well versed with, and we have a radiation safety officer, level 1, level 2. We have a level 2 radiation safety officer who takes care of all these things. A smaller establishment, there are a people, there are a biomedical engineer, they come as a handy, and they come and help many smaller establishment because they are well versed with how to take a ERP permissions.
Yeah. As sir said, there are third-party vendors who can take care of all your X-ray machines which are there in your hospital, be it a C-arm or a portable X-ray or a fixed X-ray, whatever X-ray radiation equipments are there, they will create ARB certification. And one important thing here is regarding the TLD badge. These are being issued and they have to be regularly checked and stored as per the law. So that you'll have to take care. The TLD batch which is given to the radiologist as well as the surgeon who is using the C-arms or other radiation equipments. Generator license is again given by the one is electrical people as well as generator license. Then having indemnity on the hospital. What exactly it is? Most of us have our own individual professional indemnity, but having a separate hospital indemnity is also essential. Many of the firms, private firms, are giving that. So it is also, it has to be planned and taken care of, because whenever a legal implication is there on any case, the judgment can come in two ways. That is either to completely to the surgeon who is operating, or part to the surgeon and part to the hospital. So when it comes to individual indemnities, the individual indemnities are paid only the award which is given to that surgeon and not to the hospital. So there we fall short of the funds, or the hospital has to bear the burden. So it is always better to have a hospital indemnity of whatever magnitude the establishment is there. Various companies are there, you can have the indemnity. Then what is regarding hospital insurance? Hospital insurance is for, you will know, if you take any banking loans, they themselves will advise you to take hospital insurance for any untoward incidents like fire or any mishaps. So these things are taken care by this hospital insurance. So next, management. The important topic, management aspect, proper documents, documentation, how important it is. Dr. Madhusudan sir, can you add? Hello. Yeah. As Dr. Naz madam told regarding the software, many of these aspects are taken care by the software, not only the billing aspect, but also the case sheets, the proper consent forms. Naz madam, can you add here? Hello.
Yeah, regarding the consents, I would like to add here. See, we cannot have a blanket consent form. We have to have a consent form for different different procedures and the complications. We have to explain to them very carefully, and we have to take a signature that they have understood what we have told them. Otherwise, we simply take a blanket consent from them, and at the end of the procedure, when something happens, they say we have not been told about this at all. So this is more important, especially in surgical and critical care units, where the incidence of mortality could be high, especially in critical care units. And billing, again, if you have a central billing, that would definitely add on to your ease of management of money. And when you have a facility for electronic payment, that would again be very easy for the patients as well to do your payments.
Dr. Suraraju sir, can you add on what exactly is financial consent?
Sir, the financial consent is very, very important in medical field. Is very tricky, sir. What happens, for example, on appendectomy, we tell them that the procedure cost is around 75,000 plus medicines. But most of the time they get confusion. Initially you told 75,000 plus medicine and you're telling right now the cost has gone up. We don't know how much the medicines we need to add for each procedure. Sometimes unexpected costs, unexpected investigations, and unexpected more number of stay is going to add more billing to the patients. So this is the tricky, very, very tricky. In the operation theater itself, we don't know which medicine, which antibiotic we may have to give on table, which is difficult to explain. And sometimes general anesthesia, when you give sevoflurane versus isoflurane, sometimes we need to change according to the patient's status. This is very difficult to tell. At the same time, the way we collect the money from the patient, we need to be a little bit smart, sir. Always collect the advance. Now the government says if patient dies in the ICU or sudden deaths, don't collect money. You are supposed to hand over the dead body to the patient.
Yeah.
This is where the trick is. We have to little bit very carefully collect the advances. We need to separate the billing in two patterns. One is investigations versus one is treatment. For example, before investigation like CT scan or MRI or any blood investigation, you need to collect them, advances, money. There are two advantages. One is you are explaining what procedure we are doing. Most of the time, what happens, we are in hurry to give the treatment. We forget to explain why this investigation is done. By making into two divisions, what happens, we have time to talk to the patient, especially when they go to the billing counter, they will ask question, why this CT is done. So during that time, it is easy for us to explain and collect money separately for CT, MRI, or I-Fi investigations. And rest of the treatment, we need to smartly collect the money in advances. So the billing part is very important, very crucial. Over a period of time, with experience, we will learn, sir.
Yeah.
And it is very important for us to make money. Without making a profit, please don't, we all medical doctors, what mistake we do, we are in a habit, we hesitate and we shy away telling that we are making profit. That is wrong. Unless you make a profit, good money, you cannot run the hospital, sustain the hospital, or you want to have more number of hospital. Indirectly, you're helping the society by giving more jobs and giving the health care. So we need to change our mindset.
Yes,
We
sir.
doctors, rest of the IT industry, they very openly tell this much money they have made around 1,000. So they are, at a rate of 14%, they are growing. But when it comes to the healthcare, how many hospitals they come forward and tell that we are making money at the end of the year around 10% or 15%. This is where we need to change our mindset, sir, I feel.
Yes, sir. Regarding financial consent, there are two things. One is, as Suraraju sir said, if it is a surgical patient, then we explain them what is the package amount. So there is a rider here. We will have to have a separate consent form for finances, mentioning what is the room they are choosing, what is the room rent they'll have to pay, and what will be the surgical package what they'll have to pay. Along with that, we need to learn from other professions also. You always see whenever we sign some documents, there is something called a star and mentioned conditions apply that in case of complication, the billing can go ahead. This thing has to be mentioned in that consent form and explained to the patient also, and take a signature of that. Many times what happens is during admission, there is a separate attender. When it is comes to final billing, there is a separate attender. This document will help you when a final billing is done and they create some problem for paying of the bills. So you can always show that this has been explained and this was the amount which was agreed upon, and this is the reason why it has gone up or it has remained the same. So you have a proper document. So financial consent is also very essential. This is not only here, even in abroad countries, even in government hospital, financial consents are taken, like Australia and other places. Financial consents are must. Then regarding consultant policies, can I ask Chaudhary sir, who also has a lot of visiting consultants, what are the various consultant policies which are essential? Hello? Sanjeev sir, can you add?
Yeah, we need to have a proper consultant policy because tomorrow, because the other visiting consultants, apart from our in-house consultants, if you have other visiting consultants who are probably utilizing the services of your hospital and given a one copy to them, one copy to us, keeping into our HR, this one, it should be there. Because what happens, if whatever the hospital policy is there, if they are not read, the visiting consultant has not read properly, and that can lead to, unfortunately, a misunderstanding between the hospital and the consultant. There has to be a proper policy, written down consent, and what should be the visiting hours, and what should be the services he'll be providing, what shall be the charges he'll be making for that, and what fees hospital will be charging for the patient. Suppose there can be a type A consultant, type B consultant, type C consultants, various type of consultant or how the corporate hospital does it. Similarly, they have opportunities in the hospital. If there is a type A consultant, he is spending 4 hours or 6 hours in the hospital. If he's a type B consultant, he may be spending an hour in the hospital, or he may be a type C consultant who will be only admitting his patients to the hospital. And various category consultants will have a various advantages. Being a type A will have a maximum advantage of the hospital. He may get the hospital patient also for his this one. Not only he is getting his own patient. Type C consultant, he'll be getting only his patients. He'll be not getting any in-house hospital patients. So these kind of the agreements are very, very essential whenever we are running a bigger hospital.
Yeah, thank you, sir. What exactly sir meant was having your own consultant policy is very essential, and keeping an open dialogue with these consultants is also very essential on a timely basis. The first 6 months they work for you for certain agreement, and suddenly they start feeling that they are underpaid or something like that. You should always have an open dialogue with them that they are approachable to you or you are approachable to them. So that keeps your hospital running smoothly, and there will not be any problems in coming days. Then again, Surya Raju sir, can you add on organogram?
Yes, sir. Sir, we now see that hospital in the beginning and over a period of time previously how they were running, and today it is totally different. Initially, most of the homes were converted to nursing homes with very minimal manpower. Today, hospital plus hospitality with the proper planning, with the proper organogram and sharing the roles and responsibility of each person is very, very crucial to run the hospital successfully. Otherwise, what happens? We have an employee who if they are not given specific roles and responsibilities, they tell that someone is supposed to do that work I am doing for him. So it is like on the top CEO, below that administrator, then departmental heads and front office insurance policies. Then most important thing is housekeeping department, and as well as we call it as this maintenance department.
Yeah.
So we should have a dialogue once in 1 week or 10 days, interdepartmental relationship and interdepartmental communication is very, very important. When it comes to if someone skips their roles, it can affect the entire hospital system. So we need to strike a balance, and we should have that system, sir. Now the hospitals, we cannot just one man for one front office. They will do front office, they will do insurance, and they will do counseling. That era is gone. We should have a specific people with roles and responsibilities, and they have to do their job paka. So that is how the system is. Now that organogram is very, very crucial, sir.
Pawan?
Yes, sir. Yes, sir.
Yeah, as far as the consent part is concerned,
Yeah.
See, the scenario in the metros and peripheral hospital is totally different.
Yeah.
Most of the peripheral, what we have seen is it runs on trust.
Yes, sir.
Lot
But
of things are
I
easy
would like to
for
differ
us.
here. In coming days, the things are changing a lot. So
No,
we
not-
need
not
to
that
copy
way.
at least few things from what is happening in metros. Financial
No.
consent, it's just a paper in your case sheet. So
Yeah.
it is always safe to take a signature on that mentioning what is your charges.
Yeah,
So
that is
that-
right.
Yeah.
What I'm saying is it's not a blanket statement that we don't take consent.
Yeah.
Definitely, we have some flexibilities in the periphery.
Yeah.
And because the consent part is a very serious issue now, we need to take the basic part is we need to take the consent in the local language that is understood by the patient.
Yeah.
Yeah, for us, taking a video consent, audio consent is very difficult in the periphery. Third is like the local format, that is local language, that is in Kannada. KSCASI can take a responsibility to publish the basic procedural consents like appendicectomy, excision of the cyst, cholecystectomy, laparoscopic, open, whatever it is in Kannada. There is a definite fixed format for every consent. As Naz Madam said, individual procedural consent is a mandatory. You cannot take a blanket consent. We can publish a general common procedures in Kannada.
Sure, sir.
Chandrasekhar, you can take a call on that.
Yes, sir.
Sir, definitely.
Coming to next point, patient charter. This is one of the prerequisites in KPMA also regarding publishing of patient charter. It's also quite essential, and it has to be displayed. Regarding few of these code blue, code red, code yellow, I'd like Dr. Sanju sir, if you are following this at your hospital, you can add a few words on that.
Yeah, any hospital, ideally, there has to be a certain codes to be followed. To tell you frankly, Pawan, we are also not following them. And
I'd like to add few points here. How we evolved. Earlier days, the first 4 years of my establishment, me and my physician faced a lot of problems because we used to have one casualty nurse, and if there is an emergency in the casualty, we had to make a phone call the person from the other floor or other area for help. So they never used to understand what is the seriousness of the call. So what we introduced, 3 of the hospitals in my place have introduced this. We have made some code blue, code red, code yellow, and code green. It is a very simple system. In your hospital, we can implement it. Any electrician can do it. Every floor has these 3 colored bulbs, and there is a single alarm which entire hospital can hear, including my residents is in the same hospital. Even I hear the bell when it is rung in my hospital, in my house, when I am there at the house. Any floor, they click the button of blue, we understand that there is a emergency in one of the floors. Even the floor marking also can be done through some expertise electrical work. So I could have shared that video with you. We do mock drills also. Surprisingly, I press blue button even when there is no emergency, and I see to it that within 25 seconds, I have measured the time also. Within 25 seconds, 10 people with 2 different sets of emergency kit are standing in front of the patient when there is an emergency. That is what is code blue. It helps a lot when there is a witnessed arrest to revive these patients. So these things, though the spending on this maximum, I would have spent maximum about 10,000 in establishing this system, but it has helped a lot during last 5 to 6 years. We have started this and it has helped a lot. So I request, what is code gray is when there is a violence, that is code gray. That is a new terminology which has come in Australia. Even in India, few of the cities